Erectile dysfunction is the inability to obtain an erection sufficient for sexual penetration or sexual intercourse. This can mean something different for each individual person. For some people, it means being able to get hard enough to penetrate, but not be able to sustain the erection. For other people, it may be the challenge with obtaining only inconsistent erections, and for some people, they're not able to obtain an erection at all. Erectile dysfunction is common. At least 1 in 4 men will experience some type of erectile dysfunction after the age of 40, and that increases with time. Unfortunately, we as men don't talk about erectile dysfunction enough. If we talk about it more, we'll have a better understanding of how frequently other people may experience this issue. There are many causes of erectile dysfunction. These can range from diabetes to high blood pressure to cardiovascular disease. It can even be caused by treatments for prostate cancer or even rectal cancer. For some patients, erectile dysfunction can be partially psychogenic and can even be due to medications prescribed by another provider. Erectile dysfunction is commonly diagnosed based on history reported by the patient, as well as questionnaires assessing how well the erection can be obtained. In addition to that, I often perform blood testing on my patients to check things like testosterone. Also, we commonly will perform an ultrasound to evaluate the blood flowing in and out of the penis to better understand what the exact cause may be. Many of my patients ask what they might be able to do to help decrease the risk of the erectile dysfunction becoming worse. I encourage all my patients to have a healthy lifestyle with exercise as well as healthy eating, as well as managing the medical issues that they might have. For example, if someone's erectile dysfunction might have been caused by diabetes, well, we don't want that diabetes to become worse, because worsening diabetes is going to also result in worsening erectile dysfunction. You may be able to start your initial journey with erectile dysfunction treatment with your primary care physician or at a men's health testosterone clinic. However, these centers can be limited in the ability for them to be able to treat the whole gamut of erectile dysfunction. By seeing a specialist like myself, you'll have the ability to talk in depth about whether injections or oral medicines or vacuum erection devices or even a procedure might be best for your personal quality of life and for you to be able to restore your erectile function. There are several treatments for erectile dysfunction. However, depending on the provider you may see, you may not be offered all of these options. For most patients, they're going to start with oral medications. However, these oral medications need to be timed and they might not work for all patients. After oral medications, other patients may prefer to use a vacuum erection device or even a constriction band. However, you can imagine that these might be uncomfortable to use or embarrassing to use. There is a medication which can be inserted through where the urine exits the penis. This is called Muse. However, this medication is infrequently prescribed due to obvious discomfort that a patient might experience while placing this medication. Penile injections is another method for obtaining an erection, and this is a great way to obtain erections when oral medications don't work. However, you can imagine the process of performing injections is not spontaneous and unpleasant for many. We do have procedures where we can improve one's erectile function. These procedures with penile implants allow men to be able to restore their sexual function confidently as well as permanently. As we discussed previously, I perform a thorough examination, history, physical, blood testing, and even sometimes an ultrasound of the penis to help identify why might somebody be developing erectile dysfunction. Based on these findings, as well as discussing with the patient what they want in their life and what they see as good quality of life, this helps us determine how somebody might best be treated. For many patients, oral medications may not work well and they may need to move on to other types of treatments. Even though there are several treatment options that exist, we don't have to try all of them. Remember, what we're looking for is best how to improve one's quality of life, and if that means moving straight to a procedure, that's okay. Understanding the satisfaction rates of different treatment options is very important for patients. Oral medications can be highly satisfactory. However, it does need to be timed. Most of these medications need to be taken about an hour before sexual activity, and they can even cause side effects. And you can imagine that type of non-spontaneous activity can reduce patient satisfaction. We discussed vacuum erection devices, and although these may help one to obtain a better erection, you can imagine the process of using a vacuum erection device can not be satisfactory to many. Penile injections are a great way to obtain an erection. However, you can imagine that the process of performing an injection is not going to be quality of life for many people and reduce satisfaction. For many patients, only half of them continue with penile injections due to the nature of what is involved. Penile implants is another method in order to improve erectile function. Many studies have been performed on penile implants, evaluating both patients as well as their partners, and these studies have shown greater than 90% patient satisfaction as well as partner satisfaction with this treatment option. Long-term consequences of not being able to attain a good erection can result in decreased satisfaction, decreased quality of life, and change in one's relationships with others. You can imagine that erectile dysfunction, as well as sexual function, can be important to quality of life. In addition, for patients who don't have good erections, you can imagine that they can develop microtrauma to the penis and develop even curvature, which is what we call Peyronie's disease.